but I'd like Dr. Purcell to give us some measures that can be used to keep your God-given joints and not require joint surgery. What would you say to that?
I think the key is understanding what can be done and what can't be done. So being honest with oneself as to what are the decisions that a patient can make that can determine whether or not they end up needing an artificial joint, whether it's particularly a knee or a hip, and with the newer artificial ankles. So we talked about weight reduction. There's a direct correlation between someone being obese and the failure of those joints. In fact, there are ethical discussions going on saying that orthopedic surgeons should not operate on the morbidly or massively obese patients because it's an unfair usage of healthcare resources and healthcare money, because those people are going to fail those joints, and maybe that money is better used for someone for a cancer treatment or to help them with a congenital problem. So weight reduction, activity, being active, not just good for your heart, it's good for your body. And maintaining muscle strength so that maybe the total joint doesn't need to be used. Trying to adapt one's job so maybe repetitive stresses on the knee or the hip could be eliminated or reduced. And then there are things that the doctor has the responsibility for. Prescription anti-inflammatory medicines, sometimes steroids, sometimes physical therapy can make a difference. And it becomes the responsibility of the doctor to be judicious and for the doctor to be honest and not have someone go for physical therapy for months and months and months, hoping and praying that it's going to work, because doctors are human beings and we all want our patients to get better. And sometimes we blind ourselves to the fact that some of our treatment recommendations are not working. And we hope and pray that they will, and we continue to let people take the same medicine for a prolonged period of time or the same therapy for a long period of time without benefit. So knowing when to cut bait and change direction is critical. There's the whole aspect of injection treatment, steroid injections, but they have to be done carefully. You can't just give a cortisone injection week after week. There are typically limits to several per year, but that can increase the lifespan of a arthritic joint to avoid an artificial joint. And then knowing what not to do is just as important about the care of patients as knowing what to do. So there's probably $100 million market in some of these stem cell injections, and people are mortgaging their homes to pay doctors to give stem cell injections and platelet-rich plasma. These have roles in medicine, but their role in regenerating a joint or rejuvenating a joint is just not there yet. The literature isn't there. When it comes, then we can change our perspective. But so many people are attracted to these treatments because they're so desperate. And desperation leads to bad things like the use of Laetrile years ago, which was really cyanide that was given to patients in Mexico. People left major institutions that take Laetrile and, of course, died from the treatment because they were so frustrated that they wanted something done, whether or not it was valid. So, there's a lot to be considered in who needs that joint. And again, not being frivolous with either the doctor recommending the total joint or the patient jumping to that suggestion to create only slight improvements in the quality of life. It's an important decision that has long-standing repercussions, because when an artificial joint doesn't do well, the things can lead to death, permanent infection, amputations, a litany of horror stories that can occur, although most patients and most doctors assume that everything is going to be fine, but that's not the truth. there are complications, there are risks, and it happens to people.
Absolutely right. So we're coming to our close. Who's your favorite person in history and why?
I've always had a fondness for Einstein.
Okay.
And the reason why I choose Einstein is because he was so multidimensional. I mean, obviously a genius in what he touched and what he has allowed us to gain in our understanding of the universe. But he never lost his morality, never lost his ethics, and his deep understanding and compassion for the human condition. And that's a rare person who can be in the rarefied atmosphere of theoretical physics and yet be a good human being and try and be a force for goodness in the whole human condition. So I find him pretty unique and pretty special for that.
Excellent. What do you like to do in your spare time, Dr. Purcell?
Well, before the COVID virus, I liked visiting my kids and grandchildren in New York. I'm in Arizona right now, so I'm not a big fan of plane trips at this point. So there's a lot of FaceTime and Zoom time. But I like being outdoors. I like hiking and skiing. I like traveling. I'm in my own practice, so I am my own boss. So I can take some time to travel and see the world and see how different or sometimes how similar we are in different corners of the world, and also see nature and the different animals. I was in Costa Rica and Panama about 3/4 of a year ago and walked by and saw an anteater nibbling on some, I guess, ants.
Okay.
And I thought that was a really wonderful opportunity to see nature in a form that's a little bit different from Arizona's nature.
Excellent. So you've been listening to Dr. Ralph Purcell, a practicing orthopedist and medical legal expert on Dr. Vision. Dr. Vision is being broadcast on Praise 94.5 FM in Beaufort, South Carolina. It's brought to you by a grant from the American Academy of Communications. For Dr. Vision, this is Dr. Frank Brown Jr. signing off. Until our next Vision Series program, be well.
You have been listening to the Vision Series with Dr. Frank Brown Jr. We hope that you have enjoyed this program, and we look forward to having you tune in the same time on next week. God bless.